If I asked you what hepatitis C is, if I asked you if it could kill you, and if I asked you if you thought you were at risk of it, would you know?
So this is an easy to transmit, blood-to-blood transmitted virus that sits in your liver quite quietly, a little stealth virus, rots your liver, causes cancer, causes cirrhosis, and will kill a large number of people who catch it within 30, 40 years.
People don't die of HIV anymore. People don't get AIDS. People die of hepatitis C. You know, it's that simple, and you've got to get tested.
Hepatitis C really, at that point, had ravaged his liver. Occasionally, I think he was drinking, so it made it worse. That's how it is. It kills you.
My name's Joya, I'm 44 and I live in Merseyside. For the last 4 years, I've been grieving the loss of my dad. He'd always been a sporty and pretty healthy guy, and based on how he looked and the energy he'd always had, we never had any real reason to suspect that he was unwell. But since his death, I've come to understand that what he died of is killing many more people like him. My dad had always been a really happy, healthy guy. He'd been into fitness, healthy eating and taking care of himself, and encouraged me to do the same, and I love that about him. But since his death, I've come to understand that what he died of is killing many more people like him. In 2002, I'd returned from a backpacking trip and went for a meal with my parents. At that meal, my dad would tell me that he was diagnosed with hepatitis C. We didn't know it then, but that meal would mark the change in our family's lives forever. I went to London to find out more about hepatitis C and what the impact of having the virus is. What I would come to learn is that my dad's story is not uncommon.
It's a virus that's transmitted by blood-to-blood contact. Once it gets into your bloodstream, it settles in your liver, and over 20 to 30 years, it will slowly start to rot your liver. So most people who catch hepatitis C don't know they've caught it. It sits in the liver and slowly destroys their liver, so that after 30 or 40 years, they end up with end-stage liver disease, a dead liver, and the only way out of that is by a transplant, or they get liver cancer.
In his late teens through to his early 20s, my dad had injected heroin. It was the 1970s, and back then there were no needle exchange facilities, so it was probably during that time that he had contracted the virus.
And then you've got people who would, what you'd call the baby boomers, who in their youth played around with drugs, probably don't even associate themselves anymore whatsoever with drugs at all. They're a really hidden group.
People with hepatitis C can commonly go without noticeable symptoms for as many as 20 to 30 years, and for this reason it is often referred to as the silent epidemic. My dad was one of those people and was unexpectedly diagnosed by his GP before a routine operation.
He wasn't very well. He had an hernia, and he went to his doctor, and our doctor's been very thorough, decided that they would do a full screen, blood screen, before he would go for the operation, which they did. And then he was called in, and he was told he had hepatitis C.
With over half of the estimated people in the UK with hepatitis C unaware of their infection, I wanted to know what groups of people were at risk.
It's very rare to transmit sexually. It's very rare to transmit by casual contact. But if you've shared someone's toothbrush with blood on it, you might be at risk. If you've injected drugs, you might be at risk. If you've had healthcare outside the UK, you might be at risk. So anything that involves blood-to-blood contact is a hepatitis C risk factor.
I'd always thought of hepatitis C as a drug user's disease, so I was surprised to learn that recent trends of behaviours, like travelling abroad for low-cost dentistry, posed such a risk.
So if your dentist is using equipment that's not properly clean, not properly sterilised, you're at risk of Hep B, Hep D and Hep C. Plus, of course, there's always the HIV concerns. So I would be very anxious about people going to countries with poorly regulated health practices and getting any form of needling at all. So tattooing, dental treatment outside the UK in countries with poor hygiene standards, not a smart thing.
Prior to 1992, blood products were not routinely screened for hepatitis C, meaning that people that had blood transfusions are now a whole new cohort at risk of being undiagnosed.
On a monthly basis, we have at least 2 or 3 people who are newly diagnosed who don't know how they got Hep C, who have never been used drugs, who, the only way they can have it is through infected blood.
Treatment for hepatitis C has changed massively in the last 5 years, but back when my dad was diagnosed, treatment was much more aggressive and often unsuccessful.
So when I started treating hepatitis C, I would see people, give them 3 injections a week of a drug called interferon, and I would cure about 10-12%. And the interferon made them feel lousy. Then it got better because I could give them more tablets, and I was curing 20-40% of people, but the side effects were worse. So I was giving people 12 months of depression, fatigue, weight loss, hair loss, sort of mild chemotherapy, and I was curing less than half the people I saw.
I remember the feeling of despair that the treatment hadn't worked. It was a very dark time for our family, and I recall distinctly wondering if things would ever improve for people with hepatitis C.
It came a point about 10 months into the cure that the cells started to stop dying. So then we knew that the cells had hidden and started to change, and now they were actually fine with the interferon. And in fact, I remember the specialist nurse begging your dad to stop, because dad wanted to continue. He said, I'm gonna kill them, I'm gonna overcome this, I will. But he said, no, you won't. Now you will only hurt yourself.
Those who will develop hepatitis C can take some comfort in knowing that today's treatments differ hugely from what was available when my dad was first diagnosed. There's no vaccine for hepatitis C, but there is a treatment that works for almost everyone that has the virus.
Within the last 5 years, we've gone from very ineffective, real side effect prone treatments to absolute mother's milk. The current tablets, you take a few tablets, you take them for 8 to 12 weeks, 97% of people get cured. Nobody knows they're taking them. They are almost side effect free. We haven't seen problems with them. We've given them to millions of people, and they cure everyone.
As part of a groundbreaking deal to eliminate hepatitis C by 2030, the NHS now want to find and cure those missing people with the virus. But this can only be done by helping the public to understand if they're at risk and to get tested.
Misinformation, misunderstanding and stigma. It's a drug user's disease. It's a social disease. There is a cure. It's really easy treatment. It's no big deal. But the consequences of not having a test and not finding out your hepatitis C until your liver is really damaged are huge. You will know, and I know for my best friend, it's the most horrendous way to die. And no one needs to go through that. And that's the bottom line.
My dad did manage to finally clear the virus just 1 short year before he died. But sadly, the damage had already been done. My dad passed away in January 2017 of portal hypertension as a result of hepatitis C. My dad wasn't aware of his infection for many years, and that had a catastrophic effect on his liver. An effective cure came too late for him. My family have lost a wonderful man and an incredible father to hepatitis C.
Something that was so important, not only a life, but it took away some of everyone's life, particularly mine, my granddaughter and my immediate family. It rips your heart apart, and we all miss him.
Knowing you're at risk and getting a test means that you are easily able to access a treatment that will work, and that potentially could save your life.